A lot of your experience is in large language models, LLMs, and we as the public are very familiar with it, with chatbots such as, Claude, Gemini, ChatGPT. But you mentioned that you were doing something with LLMs for clinical work, note-taking or establishing and reviewing electronic health records. Why do you need specific LLMs for the electronic records? Why can't we just use what we have out there already?
Yeah, so I always like to say, I was working in NLP, natural language processing, before LLMs. So we were using language models before they were large.
Okay.
And the idea before LLMs were created was there's a lot of free text in electronic health records. So when a patient comes in, as a doctor, I see them, I write a note, and that note can be very different if I wrote it or if someone else wrote it. We might use different words, different terms. And as a doctor, I'm sure you know, we use a lot of clinical jargon and acronyms. One example we talk about is, for example, atrial fibrillation. That can be abbreviated to AFib or AF. It's very hard to then, for someone to take a step back and use that data effectively because it's said in so many different ways. So the point of having language models structure electronic health records is you teach a model to understand the nuances of these different terminologies and then aggregates that data on a much bigger level. So, you have electronic health data for 20 years. If you have a language model that can structure text data, then you can look for atrial fibrillation across the whole 20 years, across 10, 20 million patients. And that gives you so much power of big data. And, this is especially important because we know most of clinical information, estimated around 80%, is embedded in clinical text. So it's not the structured stuff. It's not the blood tests, it's not the radiology images, but it's in the reports, it's in the notes. And that's why it's so important to unlock that data.
Absolutely. And the reason we can't just use the models that are out there for the general public is they're not really trained on these medical terminologies and jargons. So it's harder to translate that into something that's quite niche and specialized, I imagine.
I would caveat that with saying that now LLMs are getting more intelligent. They do understand and can unravel a lot of these acronyms or problems in text. But the bigger problem is you can't just take ChatGPT or any large language model and expose that to electronic healthcare data, which is a very sensitive, protected data, right? It's partly from the intelligence point, but more about the governance side.
So there's so much promise with LLMs and what they can do for us and how they can make our lives better, but there are also errors and safety risks from using them that we may not always be aware of. Could you talk us through a little bit about common errors and pitfalls or things that we might not necessarily know about?
I remember this super clearly because it was around Christmas time 2 years ago when ChatGPT was released. And it felt like I was having a second Christmas because, as part of my job, I get to speak to ChatGPT, play with it and understand it more, see what problems there are. And we published a paper on this called AI Chatbots Not Ready for Clinical Use. We can share the link. Very early on, we saw big problems with large language models. The most common one, which you may have heard about, is hallucinations. So this is when the model generates infactual or unfaithful information. You might ask a large language model, what's the capital of Paris? And it might just say something completely wrong, but it'll say it in a way that's very confident as well. So as a layperson, you'd be led to actually believe this large language model. This was a big problem, and most users of ChatGPT at that time was very worried because these hallucinations kept propping up. It was very weird because people wanted to use this technology, but then they realized it's very inaccurate and we can't depend on it fully. Since then, hallucination rates have become a lot better, a lot rarer, but it can still crop up. And then we also saw that LLM responses were not only highly confident, but highly verbose. So they would say a lot of words that don't really mean too much. They use a lot of words to get a meaning across. And it was exposed quite early on that the process in which they train large language models, the final stage, which is called reinforcement learning, what they did was they had essentially users it's like A/B testing, right? They'd look at two outputs from the model and they'll select which is the better outputs. And it was exposed quite early on that this work was outsourced to workers in Kenya in basically just like a factory, right? It's no surprise that the LLMs are overly confident and overly verbose, because when you put two responses to a layperson, and let's say it's a quite difficult question, like a domain expert question or a scientific question, they don't actually know the answer, right?
Right.
But of course, they choose the one that's more confident sounding and seems more comprehensive. This is actually a problem that was imbued into large language models by humans ourselves because of the way we were training it.